We're really privileged to have Professor Charles Branas with us today, who's the chair and Gelman Endowed Professor of the Department of Epidemiology at the Mailman School of Public Health of Columbia University. He's also director of the Columbia Center for Injury Science and Prevention. And he's an elected member of the National Academy of Medicine. And that speaks a little bit to the remarkable breadth of his career and also for how much he has accomplished. And it's really impossible for me to summarize it. But just briefly, he received his bachelor's from the Franklin and Marshall and also his master's of science from Drexel University, followed by his PhD in public health from Johns Hopkins. And then he did a postdoc at Cal. He spent the first part of his career at Penn and really established himself as someone very important to our understanding of what public health means, particularly in urban environments. In over 200 publications, he's talked about things like gun violence, as he'll be discussing today, also as it relates to substance use, mass shootings, urban blight and its impact on communities and its impact on violence in communities who are at risk. Also the fentanyl epidemic, the impact of sleep behaviors and how they can impact communities who are at risk. And as I say, really just a remarkable breadth that he's brought to the table around issues so important to urban communities and how we think about them and how we think about their health and how we think about our role in supporting them and supporting their health. He's widely quoted in publications like we all read, the New York Times, the New Yorker, CNN, the PBS NewsHour, and really has brought to bear the science of epidemiology, again, as we try to understand better how to support communities who are at risk, communities like we serve in our hospitals and in the Ryan Centers. Professor Branas, it's really a delight to have you with us today, and welcome.
Thank you so much. I appreciate it. Thanks for the introduction. I think that was fantastic. I forgot about a number of things in my history that you raised. I truly appreciate that. So I want to talk to you today about gun violence, as you mentioned, and which has been something that's been a big part of my scientific interests. But I also want to talk to you more broadly about place-based change in the very environments that surround us and surround our patients, and the importance of understanding the environments and the context from which your patients are emerging. I want to start with a little bit of a parable. So births and deaths in the US in 2010, we had about 310 million people in the US, about 4 million people were born, and about 2.5 million people died. Now, 2010 is a watershed year in US history because it was the first time we had as many people as we had firearms. And the thing about firearms is that they're actually born at manufactured at a higher rate than we are. And they really don't die. These things are designed to last for quite some time, for centuries. And so, if you take the fertility rate of our firearms versus us, this is kind of where you're left. And I'm not a demographer, but even if you do this linearly, this has actually turned out to be quite accurate. And so you're watching where our firearms stockpile, and this is in civilian hands, by the way. This is taking, military weapons are off the table in this estimate, right? So this is in civilian hands in the United States. Now, I have a good colleague at Hopkins who will always say, if you come home from vacation and there's 5 feet of water that's flooded your house, what's the first thing you're going to do? You're going to run to the spigot in the kitchen that you left on, and you're going to turn it off. But you're still left in 5 feet of water. And the question is, what are you going to do, and can we really get around that? And I know we are often focusing on the firearms and their great fertility rate, but I have been asking for decades, what else are we going to do? What are your other choices in this realm? Now, I have to say that I am trained as an epidemiologist from Hopkins, but it's not really on my CV that I trained in the School of Public Health and Epidemiology, but I also co-trained as a geographer in the School of Engineering at Johns Hopkins. So I've been very much put in to think about things beyond simply the individuals themselves. Now, epidemiologists think about people, pathogens, and places. The traditional epidemiologic triad of host, agent, vector, which you've all heard about. You can look at this for malaria or dengue, right? So you have a mosquito which carries Plasmodium falciparum into the host, and there's a swampy environment that surrounds them that promotes the whole thing. You know, there's a mirror, well, first thing I'll say is that even among, so we have a lot of malaria experts from around the world at Columbia, and they very much support this, that, you know, if there was a brackish tidal pool breeding mosquitoes, it's still an international and very effective approach to fill in the water pools. And this is going to continue reducing malaria for years to come, and particularly long after funding has run out. And it's a different approach than trying to maintain, perhaps, let's say, the application of larvicide to bed nets or something along those lines for locals. There's a mirror situation going on, and I want to focus on the places, but there's a mirror situation going on for firearms. It is the same host agent vector environment opportunity, and when you hear people talk about, and it's a very much recent language, about the public health crisis of firearms. When I started studying it, that was not language at all. It was all about justice and law enforcement and their role, and of course they have a role in the prevention of firearm injury, but it was only about them. It was not about public health and medicine and our role in this much larger issue. But when you talk about public health and firearms, you have to begin to think, and our unique contribution here is to think not only about what we can do about the firearms and the ammunition and our patients, the victims of gun injury, but I think a broader public health approach stemming from the earliest days of John Snow with cholera in London is to think also about the environment that's generating these terrible injuries and frankly, the disease of gun violence in the first place. So I want to focus a little bit on places and that as an example to think more broadly about place-based approaches for better health. So how to abandon there's this whole cycle that goes on, particularly in US cities, and has been going on, by the way, for decades. And going on maybe for a century or more, in fact. And this issue of abandoned and vacant places in our cities is something that 50 years ago, less, was codified by policymakers and leaders of our cities, particularly our aging and legacy cities, in the form of things like redlining and approaches that didn't permit certain people to live certain places and permitted others to live certain places and allowed certain places by policy in these cities to begin to erode. So this cycle began to happen where you had these abandoned and vacant places because of horrible disinvestment, perhaps at the hands of the mayor of the city. These were visually unpleasant. They drove disorder up. Residents became disconnected. They no longer, once a place falls apart a little bit, people don't feel connected and don't feel the need to maintain it any longer, and they become this culture of anonymity begins to emerge. They don't connect with each other and they don't connect with their outside spaces. So these spaces only get worse. And what happens is criminals, folks who are looking for opportunities to commit crimes, begin to enter into these spaces preferentially. Crime obviously goes up, quality of life goes down. Then, very important, residents leave. Those who can leave these neighborhoods, okay? And equally important, businesses leave, and not just day-to-day mom and pop businesses, but anchor businesses. Things like supermarkets and banks leave these spaces. And so people don't even have the most basic, they have to leave their own neighborhoods. And again, this cycle just continues. So our thinking was, well, what if you interrupted this? Same way we interrupt we fill in swamps for malaria. What if we interrupted the very places that generate the violence and the crime and the disorder and many other health conditions as well in our blighted neighborhoods? Now, these are the sorts of spaces I'm talking about. There are pictures here from Philadelphia, from our work in Detroit, from work in Cleveland and New Orleans. Yeah, and I'll talk to you about a number of these different cities. I'm going to focus a lot on Philadelphia, but I'll talk to you about our work in a number of them. This spiral of disinvestment, crime, and abandonment, disinvestment, crime, has been going on for 50 plus years, really. And does anyone know what this is? Well, I know there are some Europeans in the room. So this is a map of Switzerland. Yeah? If you look at these spaces and you add them up, both buildings and land that have been abandoned where no one lives and no one has really taken ownership of them, they add up to a land area the size of Switzerland, you know, in our major cities across the United States. So you have a massive situation going on. We have millions upon millions of these properties in our cities, especially our legacy cities. And it's a major challenge, but I'd like to think of it, and there are some of us, including the Brookings Institute, began a discussion about this 10, 15 years ago, that it's not just a challenge, it's an opportunity. There's a real chance to begin to take over these spaces and to do something positive with them, as opposed to just letting them multiply, basically, and fester in these communities. Now, changing places in itself is, just to give you a little bit of, I guess, theory behind this, changing places is something that even the Institute of Medicine 20 years ago began talking about as a real opportunity and something that influences more people for longer periods of time. This was someone who I trained with, Len Syme, is considered the father of social epidemiology at the University of California, gave rise to this health impact pyramid that was put together by Tom Frieden, who many of you may here in New York, and the head of the CDC. And in the health impact pyramid, there's a host of opportunities to improve health, starting with education and counseling, which gets you some. Medicine gets you more, yeah, so clinical interventions, but there are just so many people that can be touched, even with a large medical system like this, okay? More with longer lasting interventions like vaccines and immunization. And then on down to things like changing the very context that people live in. And then when possible, changing the basic socioeconomic factors that lead to poor health in the first place. Now, the bottom is really challenging to do, and it's not that we're not working to deal with that. But I think there's a real opportunity staring us in the face about this changing places and what we can get if we begin to focus on place-based change. The other interesting advantage of place-based change, and I'm quoting the Centers for Disease Control here, is that changing places makes the healthy choice the easy choice. How many of you read Nudge or know what nudges are? And they work in healthcare, and this is like making little changes that don't ask people to do anything, but change their behavior in a positive way regardless. They don't take people off track. My favorite Nudge example, if you read the book Nudge, in the airport, just to take this off track just for a second, in the airport in Amsterdam, apparently there was an epidemic of, in the men's room, men not being able to hit the urinal, right? And so the brilliant planners in the airport in Amsterdam decided that they were going to get these little stickers of flies and stick them in the urinal, right? And no, there was no training program. There was no signs up. They didn't put blinking lights or anything when you missed the urinal, but it reduced floor urination by 90% without any trainings or any asking. So it's that kind of little nudging, right? These little changes to places that can really have a big impact on outcomes. Okay, so making a healthy choice, an easy choice. Now, Nudge came out only 5-6 years ago as a book, Cass Sunstein's book, but Sue Baker, who's at Johns Hopkins, who was one of my professors, created this thing called the Baker. There's this inverse relationship between what you ask people to do and how successful your program is going to be. Yeah, and when you think about the comparison between our successes in reducing motor vehicle crash deaths and our absence of success, that's the gray line, and our absence of success in firearm death rates, yeah, that's the red line. And in fact, the red line, this only goes to 2010, but the red line has actually crept up since then. Okay, so we are really steady state on this. When you begin to look at this, there's some lessons to be learned in terms of program success. So driver education as an individual level intervention has had limited success, even though we have put driver education programs in every school. Now, it's not that we want to do away with driver education, but a lot of people think that these other what are called passive interventions, literal changes to the roadway that just change your driving behavior without inconveniencing you, yeah, and that are there to help you. And the other great example is airbags, yeah. So an airbag is there to change things for you and to protect you in the event that a crash occurs, but you don't change anything. You don't need to do anything or remember to do anything to do that. And these are place-based. In this case, the place is either the car or the roadway environment, and these successes have really driven up that reduction in the gray line. So making the healthy choice the easy choice is the other big thing. Now, just a point about policing. Brief point. So policing, we're not going to do away with it. And so policing is vital. And there are many, to this audience too, there are many important cops and docs programs where police and medical providers get together and actually have great successes in their communities in terms of reducing crime and gun violence. This is a study that was done several years ago. Police work. Now, we can debate the negative consequences of extensive policing and over-policing. We could talk about that. But in terms of the outcome of reducing crime, when there are police patrols in a neighborhood, crime goes down. We know that. The point I want to make in showing you this slide is once the police patrols are lifted from that neighborhood, then there are a number of studies showing this, the crime returns to the previous levels. So police may have a function and may work, but it's not the same as altering the very basic structure of that neighborhood in the hope of reducing the crime and the violence and keeping it down. Okay. So the other option is this relocation option. The MTO, I don't know if any of you have heard this. This was a massive experiment in the 90s into the early aughts. It stands for Moving to Opportunity. Yeah. Where in 4 cities, Baltimore, Los Angeles, and 2 other cities I'm not recalling, thousands of people were randomly assigned by the Department of Housing and Urban Development to receive vouchers to move out of poverty or to receive no vouchers for relocation. Yeah. Now, it's a landmark study for those people who did move in that particular arm of the experiment. It's landmark, showing the impact of place because we had clear demonstration that people got happier, obesity went down, and things like diabetes went down. Now, the challenge of this kind of relocation, well, first challenge is, are we really going to move people as place-based policy? Is that really what we want to do? What I will tell you is in the housing voucher group, in the first arm of this trial, only half of the people who were given vouchers moved. So there's a suggestion here that people perhaps don't want to leave their home neighborhood, right? Even when given the economic capacity to move, folks don't want to leave. They want to stay in place in their neighborhood in large degree. And we have a long history of moving people in this country without thinking about their concerns about their relocation. Yeah, New York City is a great historically. So there are those ethical, what I would call ethical and participant considerations here, but there's also the cost of relocation, which is pretty extensive. It's a big deal to move people, right? Very, very costly. Okay. Now, so we've taken this up and really begun to think about what we're calling in situ place-based changes. Yeah, these are in situ, literally from medical means in place, right? To keep people where they live, to make changes to their neighborhoods and their surroundings, including neighborhoods in deep poverty in cities across the US and the world, to make basic changes that don't cost a lot, okay, that are structural changes. they're changing the very structures that they experience on a day-to-day, but that also because of their simplicity and their low cost are scalable for the entire neighborhood and in fact for the entire city, and thus can be sustained over long periods of time. I'm going to talk to you about a few of these, but some of these involve simple fixes to public transportation, perhaps some stormwater issues, but I want to talk mostly about abandoned buildings and vacant lots and the work we've done there in a number of different cities. So structural, scalable, and sustainable places. And so early on, I have to say most of what we do is not our idea. Sometimes it comes from an architectural firm, some kind of landscape firm or something like that, but it often comes from the neighbors themselves and from neighborhoods who have a great idea and who try it out. So when we started doing this, I was doing a lot of studies on conflict resolution in kids, violence reduction among children, and so forth. And we were having successes, but for like 3 dozen kids. And it would last as long as I was telling you before. So we were getting frustrated in the cities we were working in, that our gun violence and violence prevention programs weren't having the impact we wanted. So we went to local communities and asked them, what do they think? Now, they told us a lot of different things, like, yes, you should focus on the kids in the neighborhood and so forth. But the one thing they kept on coming back to were the things that they saw on a daily basis. Those abandoned and blighted spaces that they had to see when they stepped out of their house every day to go to work or school. And when asked, they said things like, you got to watch out for yourself walking past those lots because you don't know who's out there. So people will change their behavior. And we have great documentation of folks in New Orleans who will walk to a completely different block to get home, will circle somewhere completely out of the way to avoid a block that has where it's just dominated by those kinds of abandoned spaces, or will cross the street to walk on the other side of the street just to avoid one of these spaces, or worse, will walk in the middle of traffic to avoid one of these spaces. So there's a lot of unintended consequences, and people are very scared of these spaces. You know, that's the vacant land, the vacant buildings, what we often hear, and it's not untrue, is that people think these are going to fall on them when they're walking on the sidewalk. I still do field work every couple of weeks in different cities in these neighborhoods, and one of my favorite stories is we were standing in front of a building and talking to a mom with her kid, and I said, oh, what a lovely house. It's so nice that you have the sidewalk to play in front of your house. And she said, no, that's my house over there down the block, but my kid can't play in front of my house because next to it is a building that's completely abandoned, and the bricks fall down from the very third floor of the building every so often. So it's just not possible for my child to sit out there and play. So we have to come here to my neighbor's house. You know, it's that kind of thing that really scares people. And then finally, I love this quote, because people told us what they wanted to have happen. And if they could do it, they would change that vacant land and those abandoned buildings. So we did an early study where it's a different outcome, but we changed a couple of lots. This is a bird's eye view of a neighborhood where the green are vacant lots, the little rectangles are vacant lots, right? The green are ones that were cleaned and greened by second. The gray are ones in the same neighborhoods that were never touched. The green that's emitting from them is where you can see it. When you're walking, that is the particular place in space where you can see the green lot. And so we put GPS monitors and heart rate monitors on people and walked them before and after the greening. So a group was walked in a space that had no change, and a group was walked in a space that had change, and we found a really significant drop in heart rate when they could see the newly greened lots. This isn't simply, what I'm going to show you coming up isn't simply about reductions in crime and so forth, but there's a biologic process going on here. People, you know, it's good to be stressed a little bit and have your heart rate go up every once in a while, but you can imagine, you know, if your block is dominated, this is a block that had 3 of them, but is just dominated by these all the time. You have to see this every day when you step out of your home, and that's too much tachycardia, right? All right, so we started with some quasi-experimental research studies where we took both spaces that on the left, either vacant land or vacant buildings. We took these, and quasi-experimental means we observed what cities did. Yeah, We didn't go out and do it ourselves, but we found spaces that had been changed and spaces that had not, and this is the type of change we're talking about in these spaces. And for gun violence, which I'll talk about mostly, the reduction was as high as 39% and sustained for something along the lines of 4 years or after the study ended. So that's our post period in this. And very importantly, as I was saying, the cost of this is really low. And you know, the policymakers are interested in the 39% reduction, but they're really interested in the cost here because there's a laundry list of options of how to reduce gun violence in your city, right? But this is, you know, basically, for at least for the land, it's like $1.25 a square foot to implement this, and $0.05 a square foot every year thereafter to maintain it. So, you know, every dollar in returns hundreds of dollars in societal return because the intervention is inexpensive, but also because gun violence is expensive. Not just to the medical system, but all the costs of pain and suffering and recovery and so forth, and the repercussions of gun violence far beyond when a victim is touched by the medical system or the law enforcement system. So it's a very costly disease, and so the return for every dollar you put in is pretty extensive. Now, we began to think more about, well, we can observe what cities are doing, but why don't we begin to think of it in sort of more of a medical model? And you all know about random assignment and the importance of random assignment in drug trials, for instance, right? So one group gets aspirin, another group does not, and we see who gets a headache and who doesn't in the end. Now, the importance here is, A, as a trial, it means that the scientist is doing something, but B, there's the random assignment makes the aspirin and the placebo group the same in everything except the treatment itself. Now, we can't say that about this quasi-experimental work. We tried to statistically adjust for everything we could appropriately, but it's not possible to do that. So we began to think, well, what if you did this, right? Had like actual place-based changes and had something, a comparator of some sort, a placebo comparator, or perhaps spaces that didn't get anything, at least in the short term, right? And so, well, what happened to outcomes like violence or perhaps mental health outcomes? This was, where's Sarah? I have a half hour left, maybe 15, 20 minutes?
Yeah, like 20.
Oh, good, okay. So, and I'll finish before that. So this is one of my favorites. This is the earliest place-based experiment in the Netherlands. Now in the US, we can positively change places. That is, if I see, we can clean it up. The Dutch IRBs apparently are okay with the Dutch creating disorder. So this is a study where one arm of the study was nice and clean, as you see, and then the Dutch went out and threw trash on the ground and graffitied the walls and did various and sundry things, right? And I guess they cleaned it up in the long run. But interestingly, one important thing to find is that when you start having a disordered, littered, graffitied place, it leads to, it's a contagion effect. It leads to more litter and graffiti in that space, okay? Now, the other thing they did is many of these spaces had a mailbox near them. And they did this really fascinating little addendum to their experiment. And they created these envelopes that had what appeared to be a utility bill that the money was visible coming out of the utility bill. And it was half pushed into the mailbox, right? So you could do the right thing and push it all the way in and mail that utility bill for those folks, or you could walk with the money. And in fact, there was more than double in the disordered spaces. They found that people. So this is beginning to put forward this notion that these sorts of spaces are also breeding incivilities of various kinds. And again, so this is a full randomized controlled trial. So we began to think, after discussions with various community groups, their idea, and there were treatments for vacant land in particular that we could launch. Yeah, and it had been done successfully in a neighborhood or two. This kind of a treatment, moving from left to right on your screen. This is a very protocolized recipe for what to do with vacant land, where a vacant land plot parcel has to be identified and in violation of city ordinance, right? So actually, if we were going to be passing laws for gun violence, we need city ordinances that don't permit these kind of spaces, or at least identify them as in violation. The space then gets, in the process, gets completely graded and cleaned. The landscape contractors, particularly and preferentially across the city, are asked to bid to do this, and many times folks from the neighborhood are part of the landscape teams that do the work. The space is, as I said, graded, and then they blow this, it's like they put wet vacs in reverse, these vacuum cleaners in reverse with this wet paper mixture that has grass seed in it, and they cover the space very quickly, a couple hours with this grass seed paper mixture. And grass begins to sprout in a week or so. Yeah. Now this is not, we're not making golf courses or the High Line here, but it is functional and green grass. And then a fence is put around this space, and you can't see it in the pictures here, but the fence purposely, actually one of them you can, by the red car, the fence purposely has an opening in it so that people can use the space, right? So the fence is not designed to keep people out. It's simply designed to show that the space is defended and that you can't park an abandoned car on the space or dump old furniture on the space or all sorts of other things. It is a space that's open to the community, but wants to maintain a certain amount of order. And you can see the difference visually in this space from time 1 to time 2. And you can imagine if you live on a block where there are maybe 40 homes on the block, 40 parcels on the block, and 20 of them look like the spaces on the left, if we go from the left to the right in a short period of time, the whole process for a block takes something like 1 to 2 weeks. It's a huge shift in people's day-to-day experience in a very short period of time. So we did this where, this is the city of Philadelphia. We have 2 trials, one that I'll tell you results of because it's complete, on vacant lots or land in the city, and one on abandoned buildings, which I'll touch on. These were citywide experiments in Philadelphia where at the time we had about 50,000 abandoned parcels in the city. We chose 600 of the vacant lots, randomly chose them from the 30,000 or so vacant lots in the city. This isn't the exact lots, that's confidential information. It's just sort of a rendering of basically where they were to show you that they were citywide in 4 sections of the city. I'm just going to zoom in briefly into one of these into South Philadelphia and show you. So one of the things is every one of these little red circles in the very center is a vacant lot. And it's the way we built our clusters for the study. And the thing to note is that we had some controls on the sizing of the lots. But also that the clusters are not overlapping. So the random assignment is by cluster, and they do not overlap. So you're getting a somewhat isolated impact per cluster. And in fact, on average, treated and controlled clusters were something like a mile away from each other on average. So now here's a sampling area, as I showed you, to show you 2 things. One, that that's the vacant lot that was randomly sampled that made this cluster, right? But it also shows you all the yellow in that cluster is all the vacant lots that are in that. And this is not like preferentially chosen as a cherry-picked satellite image. This is, again, we had 50,000 of these across the city. A city like Detroit has 100,000 of these in its city, right? So these are pervasive in the poorest neighborhoods of many U.S. cities. And then we went through a process of building, so we didn't do these one at a time. We built them in a cluster of 5, 6, or 7 of these, so which may or may not include the one that was in the very center. But it was always within that, and it's a quarter-mile cluster, within that quarter-mile radius cluster, okay? So this is one particular cluster, and it was assigned a point, which is called the centroid, the geographic centroid of that particular cluster of those blue lots that were selected. Okay, so the experiment proceeded in that we had a cleaning arm, which got the full treatment that I showed you before, clean, green, and ongoing maintenance. We had a second arm that had just cleaning and maintenance here is very important. People return once a month to pick up trash, to mow the lawn, to prune the trees if they're needed, and to fix the fence, although the fences rarely were attacked or destroyed. And then there was a third group, a control group that got nothing. All the groups got the full cleaning, greening, and maintenance at the end of the study. Okay, so everyone got the full greening. We had a number of crime outcomes, including gun crimes and shootings. And then we had a bunch of secondary outcomes. So for each of these spaces, we had folks that would go out and do door-to-door random sampling to find 5 people per cluster to interview over a series of waves, of 5 waves of a longitudinal study. Okay, and they would be asked things. There was a lot of things they were asked, but we were very much focused on issues of safety, usage of outdoor spaces, and then to some degree, mental health. Okay, so what did we find? Well, we found mostly that, and I'm going to focus on the shootings, but gun assaults went down. Now, there's a difference between gun assaults and shootings. So for police to label something a gun assault, you can either have someone who was shot or have someone who was threatened with a gun, right? So gun assaults are a bigger piece of the pie. It was borderline significant with the reduction, but shootings were not. So shootings where someone was actually shot with a firearm went down by a significant amount in this, what's called an intent to treat. So this is the very first basic analysis of this. So we found about a 6% reduction. Interestingly, nuisances, things like disorderly conduct, things like public urination, other sorts of public nuisances went down by an even greater amount here. Now, this is for all neighborhoods. As I said, this was a citywide experiment. But when you then carve out the neighborhoods that were below the poverty line in the city of Philadelphia, what you're finding is that the numbers are actually get better and better. It's a greater reduction, an improved impact on that community, something along the lines of 9% and very significant for gun assaults, as well as nuisances, and also for shootings, although it's not in this slide. Now, one of the things that happened in this study, as with any study, is that, well, sometimes some of in 7% of the places that were green, they couldn't be maintained, right? So they deteriorated, right, the full greening. And in fact, in 13% of the spaces that received no intervention, people got fed up with the situation of that space. Perhaps they had been waiting 30, 40 years for someone to come do it, and they just greened it themselves, okay? So that kind of contamination is something that we then took account in a secondary analysis, and it really drove these, especially for neighborhoods below the poverty line, the percentages were really improved when you think about it. So something along with 17% and 28% reduction between gun assaults and nuisances. So last few thoughts. So we think of this as an example of win-win science. So we have significant results, right? These reductions from a randomized controlled trial of an entire city in nuisance crimes and in gun assaults, significant reductions, significant and sustained reductions, as I was saying before. But we looked at all these other things too, and because they're not our primary results, right? I can't talk about them in any other way but as preliminary. But people did report that they went outside more by a significant amount. They relaxed outside more by a significant amount. Interestingly, when we asked people about, on the left, the nuisance crimes and the gun assaults, that's what the police reported to us. On the right is what the people reported to us. And in fact, people were reporting that they felt like, without checking the police plot or anything, that vandalism went down and crime went down in their neighborhood by a significant amount. And then I think very importantly, we have a whole paper on it in JAMA, serious mental illness, reports of serious mental illness, in particular serious depression, went down by a very significant amount. And we're labeling that preliminary because it was a side finding of this, but we're really following up on these mental health outcomes of this particular trial, but then a series of others. Okay, so win-win science, meaning that we generated scientific knowledge through this study, but we also, because the NIH paid for this, and the Centers for Disease Control, and the U.S. Forest Service gave us money for this study, we brought resources to these communities. So that's the second win in greening spaces in their communities. Okay, so how does it work? Well, there's a biologic response I was talking to you about. There's perhaps less stress. The mental health findings are behind that. There are also visual cues that are going on, showing that someone cares, this whole notion of busy streets. And in fact, police agencies in all the cities we work in call this an example of, quote, soft policing. That is, police appreciate this and want more of these programs because they can save resources and redirect their people somewhere else if a neighborhood is being protected by this kind of place-based change. And then the last thing is, for gun violence, there's a means reduction. So police, community members, and you should look at our paper in PNAS because we partnered with some great anthropologists who spent time in the neighborhoods, lived in the neighborhoods, actually bought property in a few of the neighborhoods to live in them for a year and a half, 2 years to figure out how this works. People call these spaces, whether they're abandoned buildings or abandoned lots, quote, storage lockers for illegal firearms. So the thing to understand is that in these poorest neighborhoods where there's been such great disinvestment, right? Obviously, one of the biggest problems is work and jobs, and people participate in, perhaps because they have to, into illegal drug markets. Yeah. Now, if if you are a business person running an illegal drug trade, and you have a dispute with someone, it's not like you're the laundromat, right? You can't call 911 and ask them to reconcile the dispute. So you have to arm yourself, right? And so this whole escalation of firearms occurs. But, you know, when you talk to these folks and go into their homes, they know that guns are pretty dangerous. And they have kids. Many of them have kids. And they don't want the gun in their house with their kid and their family, right? But they can't carry it with them in the street because almost, you know, again, we have a crisis of incarceration in the correction system. So they already have priors. If they're caught with a firearm on them, it's going to only make their sentence worse. So they're looking for public spaces to deposit their firearms, right? And these spaces are where they go. And if you can, in many cases, when we would clean the lots, there would be guns found in the lots, not just trash. So when you clean them, you remove the opportunity, whether it's lots or buildings, for these storage of illegal guns, which we think is a functional way that it's actually reducing gun violence. And by the way, not reducing non-gun violence. So this is a unique impact on violence committed with firearms, which is another reason we think that this is working. Okay. We have other experiments. As I said, there's an abandoned building experiment we have in Philadelphia now to mirror that the NIH is paying for. Another NIH-funded study on both buildings and land in New Orleans. Colleagues here, just to push the place-based initiative and the value of place-based change, colleagues here in New York City have finished a study on lighting, which we'd like to follow up on, where there's in NYCHA housing, where there is significant reduction in violence and crime, where there is lighting placed. Now, the lighting you see in the bottom left, it's not the most palatable thing, right? So the twist now, after showing that lighting actually has value, is to find appropriate lighting to be placed perhaps in NYCHA housing or in other neighborhoods, not these sorts of, it's almost like being on the field in Yankee Stadium or something. So across the board, these sorts of place-based initiatives, whether it's greening, buildings, we have some experiments with trees. Some of the earliest of these were done, they're not true experiments, but quasi-experiments in Chicago, and so I have to credit them comparing affordable housing with trees and without, on down to some of the work we're doing in New Orleans right now, which is some of the latest. But all of these are pointing to reductions, ranging anywhere from 6% to 56% for violent crime, particularly gun violence. So there's a story going on, sort of a cohesive story, and it's not just our team that's part of that story. Independent research teams are finding the same thing. Okay, so take-home points. First thing I want you to understand is that programs, the same quote statement, the programs that focus on places or structural dimensions can influence the lives of more people for longer periods of time. This is a statement from the IOM from 20 years ago, and it holds true today. Second thing, and when I talk to clinical audiences, I say this all the time, the medicine you're giving is wonderful, but please try to take note of how your patients live and where you're sending them, the kinds of environments you're sending them back into, because you shouldn't expect your treatments on an individual basis to work if you're sending people back into chaotic environments that don't permit those treatments to take hold. Yeah. And then the last thing I'll say is that we should be thinking about place-based change the same way we think about pills and potions. These can be standalone treatments to improve health for folks around the world. And that's it. Last thing is with a quote, and if you have a chance, our book is out. It's only a couple months old. It's called Changing Places. Take a look at it. It talks about gun violence, but many, many other health outcomes as well, and some really innovative programs around the nation and the world. And this is one of the lots. This is only from months ago, this picture. So it's one of the lots that's been that way for years and years. And this is in Philadelphia. Thank you very much.
Questions for Professor Branas?
No.
Thank you, Professor, for a great talk and very enlightening. And I totally agree with your point, because we see a vicious cycle where we send people back to their same environments, and they often end up going back to them. So, great take-home points. My question to you is, crime obviously occurs in a place with a lot of greenery, for example, parks, especially with the recent crimes at Morningside Park. I recall when I was an undergraduate student at NYU, couldn't walk through Washington Square Park without being offered drugs. And the major, and it was an unsafe place, and the major intervention that was done was, put up cameras in the lights over there, and we saw a drastic reduction in crime. But for whatever reason, that sort of, yes, it invades our public privacy. But that being said, can you comment on these sort of interventions in our parks?
So parks are fascinating spaces, and in cities around the nation, there are giant disagreements between the police commissioner and the city arborist. So police commissioners hate low-lying vegetation, right? So they want low branches to be cut off of trees and not to have bushes and so forth, because it's opportunities for folks to hide, right? And it decreases line of sight for their officers who are policing the parks and on patrol. Of course, arborists hate this because ecologically, it erodes the tree's ability to be healthy, right? And so actually tree mortality in our cities is another epidemic. So there's this trade-off that's going on. The parks I was showing you are little parks. So this is not building the High Line or Washington Square Park. It's not on that kind of a scale. However, even Washington Square Park, my recollection of it in the early 90s to what it is today, it's a much cleaner, more ordered place than it was at the point. Now, your other question was about cameras. So lighting, we have some idea that in some trials that perhaps there's value, although we need to figure out the nature of the lighting that's appropriate. Cameras, literature, to be honest with you, especially CCTV cameras. Now, they've been very helpful in solving a number of crimes, but whether they actually deter crime is another question entirely. There's some great studies in the UK, for instance, where a lot of CCTV cameras were put up initially. Some show benefit, but I think the balance show that there's no effect of those. Even though, that hasn't stopped widespread implementation of public cameras.
From the St. Luke site, just a comment and a question. Comment is that John Lindsay, the mayor in New York City, decided with obviously landowners that they would turn abandoned areas, buildings, into neighborhood, they were called vest pocket parks.
Oh, yeah.
And this really changed the neighborhood in that people developed some pride in their neighborhood, and they had these now neighborhood gardens that they would grow vegetables in. And you still find some of these changed the sense of the neighborhood belonging to us as a community, as opposed to I'm in my little den, whatever that is. So I think that was like a prelude to what you say has an important impact. But the question I have is how, it's a very hard work you've done. I mean, it's tremendously difficult because politics and landowners are involved whenever you have space.
Yeah.
And people I know here in New York City, old buildings have are rent controlled, relatively affordable for a bunch of people. And then the owner dies, and then somebody else comes in, moves in, and forget it. They're all thrown out because they have fixed rents. And then they put a new building in the same space. They're now luxury condos, which is happening right here on Morningside Drive. The old parts of our hospital are being turned into high-end condos. So how do you work on that? Because you're always fighting the greedy people who are constantly trying to make money. It's happening right here in the city against this. And then the last thing is, why can't we take guns out altogether so there's less of an issue?
Well, I'll address the last first. I mean, I think I said it in the beginning. I agree with you. That would be fine, but sort of the horse has left the barn in a lot of ways. And we're awash in firearms in the nation, and we need to begin to think creatively what to do that doesn't always focus on the firearm. So that, and I don't want to discourage you from that, but it's one of the reasons we went into this in the first place. This sort of place-based change, and there's some significant impact, as I showed. So I love the vest pocket part comment. I actually think that term was coined here in that era, to be honest with you. And we call these the same thing. We call them pocket parks, is really what they are. In terms of, you said something about development and rapid development. So I'm surprised I haven't been asked about gentrification because I think that's a concern here. There's a great documentary, maybe it's 5 or 6 years old. It's called Vanishing City. And it basically focuses on the breakneck rate of development in New York City in the mid 90s into the early aughts. And those developments focused around luxury construction in the city. And New Yorkers will tell you that the quality of life at a street level has changed here since those developments. Now, it's possible that those developments have also changed the crime rate in New York or are a contributor to that. But we have to balance this kind of large-scale development. I love the High Line. I take my kids all the time, but we have to balance that kind of wide-scale destination amenity luxury development with things that are distributed in neighborhoods that people can use, and the intent is not to displace people. It's to have people stay in their neighborhoods for as long as they choose. It's a difficult balance to strike, to tell you the truth. And New York City is a good example, and there's some continuing opportunity here to begin to try to strike that balance, and to go back to perhaps what Jane Jacobs was thinking more of, and that kind of idyllic New York City. And we can do it. It's just going to take a little bit more time and thought and understanding policymakers.
I wondered if you'd speak to the physician experience. I imagine I'm representing thoughts that many others have, that it can feel overwhelming to meet with individual patients or their families and just have a sense, perhaps by the stuff they bring along with them into the visit or the way they appear, that maybe their home lives are chaotic and difficult and challenging. And I just am curious, not so much necessarily related to gun violence, if you have any thoughts about if there's any impact associated with empathy. And I think often we feel powerless to really change those circumstances on behalf of individual patients. But is there any demonstrable impact in just saying, it seems to me your home life might be challenging. It seems to me that neighborhood might be a hard place to live, hard place to get good food. These kinds of statements that we're able to make in the course of a short visit.
So my clinical background is in EMS. So I was on ambulances for years, and it's a privilege, right, when you're on an ambulance to be asked to come into someone's home. So I still do go on home interviews now with people, and I'm always struck by again, the privilege of being in someone's home, but also the things that you can observe that is difficult to determine in an interview. So first thing, maybe it's asking a lot of our clinicians, but is to the extent you can go on some visits into the neighborhoods of your patients. You obviously can't go to every patient's house, that's an impossibility, but to the extent you can go into some homes and see them, you can all ask for ride-alongs with local ambulance services. I'm sure they'd be pleased to take you. There's a lot to be learned there that perhaps is generalizable to your larger patient population. The other thing I would say is, in the interest of empathy, ask. I think there's not enough asking about what the home situation is. Not just, I know there's asking about the social situation sometimes, but perhaps ask about the physical situation and physical condition of the home they live in, and the neighborhood that surrounds them, and their social network, and so forth. I know you guys have a laundry list of things to finish in a 13-minute encounter, right? This is just adding to that list. But it would be good to perhaps start to get a sense of the context your patients experience, and I think it could help guide and being more empathy in terms of the care, but also perhaps the quality of the care and the actual health outcomes of the patient. So thanks for the question. It's great.
I wanted to make a comment. It's not so much in the neighborhoods that I've been living in. I lived in Detroit for 4 years, and I lived just a few blocks from the hospital now, and I have for at least 30, 40 years. And I own property. It's not so much abandoned property as it is scaffolding. If you put up a scaffolding, you're putting up a temporary shelter. And of course, within hours, this develops 4 or 5 residents. So it's really a big legal problem. First of all, you complain to the police and they say, well, we have a team for this. And they send social workers interview people that are lying on the street, living and functioning in this space under the scaffolding. And some of them decide to move to a shelter, but most of them don't. And then they start to put up signs that they're going to be evicted. And then they get evicted, somebody comes, takes all their stuff away, and so on. The next week, the same thing happens. And this goes on and on like a cycle. Now, if we could get rid of the scaffolding, it would change the neighborhood. But the city buildings department says the scaffolding has to be up because the building is being worked on and the windows are dangerous. So you can't, it's just a cycle of problems. And the whole neighborhood gets upset by the scaffolding, And we find that it's an intractable problem. Lots of legal issues, lots of social issues. Police don't like to be involved in that. They think they should be involved in crimes, and they're right. It's a big problem.
Well, I think you need to, before you do any kind of an intervention like that or change something like that, you need to figure out what you're going to do with the folks who are under the scaffolding in the first place, right? So they're your first priority. And there need to be opportunities for them. They're under that scaffolding for a reason. So I'll just start and perhaps end by saying that. But, it's interesting you asked me this. I was asked this, I think, yesterday by somebody as well. And scaffolding is it's a New York thing in a lot of ways. Like, so having spent time in Detroit or Philadelphia, scaffolding does not happen. So what they do if they're doing construction on a building is they shut the sidewalk and ask you to cross the street. And what do people inevitably do? And they just put police tape, right? They just duck under the police tape and walk on the same sidewalk, right? And so I think that's sort of the birth of this desire for scaffolding, because you want to protect people from things that are falling. And by the way, there's some emerging literature that many people won't cross the street. They will just walk in the street. And so pedestrian injury also goes up in the absence of scaffolding. So there's a purpose for scaffolding. That said, I know there's been some bills going through city council here about how long you can have the scaffolding. And I've seen it, up in the Heights and in Washington Heights and so forth, where scaffolding is there. I mean, just part of the building. It's been there for a decade. I mean, in some cases. So I think part of the controls on scaffolding is perhaps we should be setting, strict limits on how long it can be there. It has a purpose, but I'll also return to the fact that it's the scaffolding, but the folks that are under it is part of the problem here, that we're not dealing with their issues and giving them other opportunities, and that's why they're coming to the scaffolding. So adjoining programs would be really, really important. Thanks, a good question.
Professor Branas, thank you very much.
Sure.
It was a great talk.
My pleasure. Thank you for your questions and your interest.